Across the country have been navigating the shifting healthcare landscape as the administration implements its budget bill, which hurts individuals with special needs.
And while there are other initiatives to address this, 8 News Now education reporter Ozzie Mora says some parents are feeling a financial pressure for services.
For some families living with autism, ABA therapy is a lifeline. Now, parents tell me that lifeline is being pulled out from under them by a quiet benefit shift. They say it's leaving them in a race against time, forced to choose between their child's progress and their finances.
For parents like Tommy and Stacy Ricardo, Applied Behavioral Analysis, or ABA, is the bridge between their son and the world. It's a scientific approach that helps kids with autism learn life and social skills. But to them, it's simply his future.
Our son River is diagnosed with autism. He's brilliant.
At just 6 years old, Tommy says his son already memorized the periodic table.
But he has a very hard time articulating and dealing with different social issues.
To help his son, they say he requires a registered behavior technician, or RBT, by his side every day at the private school he attends. RBTs work one-on-one with children implementing ABA therapy.
If he does not have an RBT with him, he will find his way out of the school and he will run out and he will elope.
But that safety snapped.
We are kind of battling with the insurance company right now. And
the Ricardos say their Insure Health Plan of Nevada, which is under the United Healthcare umbrella, denied their son's ABA therapy without warning. And without insurance, the couple say the cost for their son's ABA program is about $17,000 a month.
No more therapy. He has no more school. He's just at home.
ABA therapy thrives on consistency. But for other parents like Alina Slavdova, that consistency is a good penny.
We have so many parents affected right now, parents being priced out of the ABA therapy.
Alina is on a different healthcare plan and a different story. Her son attends ABA therapy after school. She says her copay jumped to $80 per day of treatment.
He used to go 5 times a week.
She went from a week to only affording a few days. Alina says she blames the shift on how insurers are reclassifying this service.
ABA therapy is a huge cost to health insurance companies across the nation.
Anna Marie Binder, chair of the Nevada Governor's Council on Developmental Disabilities, says while Nevada law mandates ABA coverage, insurers are shifting it, basically making medical necessities a fight. And the result, Anna says, skyrocketing out-of-pocket costs.
So what we're seeing is that mandatory coverage is not being repealed.
She urges families not to give up. For parents like the Ricardos or Alina, the battle isn't just for therapy. It's for the right of their children to lead a fulfilling life.
The Nevada Governor's Council on Developmental Disabilities and the Nevada Health Authority say they are working to ensure Nevadans have meaningful and timely access to medical services, including ABA therapy. I reached out to Health Plan of Nevada. They say, we empathize with Ms. Ricardo's family and are committed to helping her son receive the ABA services that are available to him under her health plan. I'm Ozzie Mora, 8 News Now.
Now, the Governor's Council recommends families who believe there was a misunderstanding of their coverage, they can file a formal complaint with the Division of Insurance.